Welcome, everyone. Thank you so much for joining us tonight for our post-transplant medication support program webinar. It's my pleasure to welcome you. My name is Candace Coughlin, and I am from the Center for Living Organ Donation. I'm the Education and Outreach Coordinator there, and I am also a kidney transplant recipient myself. In September, I'll be celebrating 15 years with my kidney transplant. So very glad to be here and to talk about all of these remarkable transplant medication support programs that we have, as well to have a pharmacist here to answer some questions for you. So let's get started. The Center for Living Organ Donation was created by UHN Transplant in 2018. And the goal of our program is to improve access to living organ donation, both for people who need a life-saving kidney or liver transplant and those who want to give that transformative gift of life. We've got a lot of wonderful speakers and information for you tonight, and we're going to try to cram it all in tonight. But please, if after this webinar information pops up, you rewatch it and you have new questions, you'll have our contact information, so you can feel free to reach out to us at any time, and we can connect you with anybody who you would like to ask questions to. We're going to start with a presentation from Derek Sang about post-transplant medication and supports. And then we'll have some time after that for questions for Derek. Then we're going to talk about Anovi Cares, and we'll show you a short video. And we'll have time for questions about that as well. And then we're going to go into the Expedite program and have time for questions. At the end, if you've listened to all of this and you have more questions, we'll have some more time at the end as well for any questions that you may have. To start it off, we're going to ask Derek to join us. Derek is the operations coordinator of the transplant outpatient pharmacy at Toronto General Hospital. It is the first and only transplant-focused outpatient pharmacy, which is pretty remarkable. He works with patients, prescribers, and other healthcare workers, and this has given Derek the skills necessary to be an expert in transplant therapeutics and medication reimbursement. So I'm going to stop sharing my screen, and I'm going to ask Derek if he can share his slides. And I'm going to pass the microphone over to you. Thank you so much for joining us tonight.
Thank you, Candace. Congratulations on your 15-year anniversary.
Thank you.
It's always, I always like to say, it's funny that we say in the world that it's such a small world that we live in, and being somebody who works within the transplant community, but also as a recipient yourself, I'm sure you get a great appreciation of both sides of I guess being a patient as well as working with the team.
Absolutely.
Yeah. So thank you for that great introduction. For those on this seminar today, my name is Derek Sang. So I'm the operations coordinator of the transplant outpatient pharmacy. So we're a pharmacy located within Toronto General Hospital, and we are very, very proud to be the first and currently only transplant specific pharmacy that works, within Canada that we're well aware of. So, allows me the opportunity to work with practitioners, patients directly, as well as, medication reimbursement specialists, nurse coordinators, nurses, name it, the whole gamut of healthcare providers to, provide the best care possible to our transplant patients. So, I do feel very fortunate that I've had this opportunity to work within that team. And I hope that in the seminar today, I can provide some information related to the post-transplant medications, reimbursement avenues, and drug coverage, as well as, pass it off to our great team over at Anovi Cares related to the services and the care and the programs that they provide as well. So I'm going to get started. And if there's any questions at the end of my presentation or my set of slides, definitely feel free to ask and raise those questions, and I hope I can answer them for everybody here. So if we look at the transplant journey in general, we typically look at 3 different stages. We have our pre-transplant population. I recognize this is a post-transplant seminar, but maybe within our group, there are some patients who are listed or who know people who are, pre-transplant. So this leads to your first interaction with pharmacy. We do have some pre-transplant patients that we service at Toronto General at the transplant outpatient pharmacy, in particular patients who have relocated to Ontario while awaiting their transplant. This can be anywhere from places outside of Ontario, so the East Coast, such as New Brunswick, Nova Scotia, PEI, Newfoundland, as well as patients from other parts of Ontario who have relocated to the Toronto area while waiting for their transplant. So typically this is the first interaction that patients will have with their pharmacist and potentially the pharmacy at Toronto General. Taking your pre-transplant medications, for our liver patients, that may be, patients taking medications to help prolong while they're listed, our dialysis kidney transplant patients. And then we have our patients who, are now admitted into the hospital and now have had the great opportunity to have a transplant operation occur. You're admitted in the hospital, you get your pharmaceutical care from the inpatient pharmacist, the prescribers, the nurses in the hospital, whether that be in the immediate time after the transplant. This may be through, intravenous, oral medications. There's a whole gamut of things, and admittedly can be quite overwhelming as we go. And then the big part that I am focused and am a great part and have great pleasure to be part of is the post-transplant process. So for our transplant patients, most of the time our first interaction is preparing their discharge prescriptions. Patients have had a successful transplant, they've had a great recovery process, and now they're ready to go home. At which point we are there to help provide the transplant medications for the patients when they go home. And then we at the transplant outpatient pharmacy also have the ability to continue their care post-transplant through their ambulatory clinic visits, as well as providing their medication. So the first thing that we talk about is a balance of immunosuppression. What is too much and what is enough? Because there's always a balance of these medications where, as pharmacists and as doctors and nurses, we want to make sure we're giving enough immunosuppression to make sure that there isn't things such as rejection or organ failure when the levels are too low, or there's not enough immunosuppression. But we don't want there to be too much immunosuppression where things such as common infections, bacteria, viruses, even germs or mold, that we're not causing those common pathogens to cause negative effects, and that's why sometimes you will need preventative antibiotics or preventative therapies to reduce the risk of those infections. Secondly, we also don't want there to be too much medication on board that you're just having negative side effects related to the medications that you're on. So it's always a teeter-totter or a balance beam model that we look at, where we want to make sure it's nice and balanced so that your organ is working optimally while we're reducing the risk of those side effects or long-term infections or risk of further complications of the medication. So the first question or piece of information is, why do we need medications post-transplant in the first place? The first thing is, everybody has an immune system, and which is a response system in your body to help fight off foreign invaders. So in a normal process, this is your body fighting off the common cold. In the springtime, where the temperature has been up and down, we do acknowledge, there's a lot of pathogens and a lot of, just common cold and viruses out there. So in the normal sense, your immune system is there to help prevent, those from causing you to be sick. But it's a complex system where it's, where we're preventing against the diseases from these things. But what happens when you get this transplanted organ, and what happens is, if your body recognizes it as foreign, what could happen? And this is where it could lead to the potential risk for rejection, which is what we're looking to prevent from happening, because we want the new transplanted organ to work as best as possible. So the first thing of which is, how would you know if you're experiencing rejection? What would that look like? There's not always a clear sign or symptom that would be indicative of a patient undergoing rejection. It could just be simple things of you just feeling unwell. So things such as a fever, generally feeling down. In particular, some people may notice pain at the transplant site. Kind of, for example, if it's a kidney transplant, over their transplanted kidney, liver, lungs, heart, or it could be something specific to that transplanted organ. For liver patients, they may see that they experience jaundice or effects with their liver. If they're they're a heart or lung patient, they may experience things such as trouble breathing. Or if they're, a kidney transplant patient, they're noticing they're not being able to go to the washroom as well. They're keeping on more fluid. They're swelling. These are all more specific signs of rejection. And this is what we're trying to prevent with your medications. Now, I'm not trying to scare everyone when I talk about rejection, but I think it is important to look at one side of the balance beam of what could happen when your medications are either not working as well as they should, or we're not taking them as intended. So there are these immunosuppressant medications, and what they are is they're that one half of the balance beam. They're lowering that immune response to prevent your body from recognizing that newly transplanted organ as foreign. And one thing I really, really, really stress, and as a pharmacist, it would not be my due diligence if I didn't speak about this, is about compliance. It is really important that when prescribed your transplant medications, that you take it the prescribed way every single day. As we go along the transplant journey, sometimes there will be times that errors may happen. And the most common question that we typically get is, what happens if I miss a dose? The true answer is, we don't know. While there's a good possibility that it may not cause any negative effects to your organ, I think it's important to recognize that limiting that risk or limiting that chance of a negative effect is the best way to make sure that you are compliant with all the medications that you take. And that's where your pharmacist, whether it's at the transplant outpatient pharmacy or any pharmacy that you get your medications, that's where your pharmacist plays a large role, is to helping you ensure compliance. And they will be there to help you along the journey to make sure that you're aware of all the different medications, how to take them, potential side effects, risks, and be there to help you along with your medication journey. So for most patients, you're typically going to be on a combination of 2 to 3 immunosuppressant medications lifelong. So some of these names may look familiar to you. There's tacrolimus products such as the immediate release Prograf, the extended release formulation, which is once a day, called Advigraf. There are things called cell cycle inhibitors such as Myfortic or Cellcept. Or you may be on one called Neoral or cyclosporin. And then there's also other medications such as prednisone, rapamune, or azathioprine. These are common immunosuppressants used within the Canadian market as immunosuppressant medications to prevent against organ rejection. Each medications themselves come with their own ways of taking their medications, potentials for side effects, as well as importance for blood monitoring. So what that is where the doctors will recommend that you do regular blood work to test the levels of certain medications to make sure that they're within a target range. It's kind of like that teeter-totter. That's how they're assessing assessing the effectiveness of the medication to make sure the levels are appropriate, but not too high and not too low. So in particular, on that list of medications, the ones that will regularly require blood monitoring is your Prograf, your Advigraf, Neoral, and rapamune as well. So I will keep it pretty general in terms of the specific side effects or risks of each of the medications, but one of the things that's really important, and I think a big part of today's seminar, is to talk about, how am I going to pay for the medication, or who pays for my medication? So as I talked about the 3 different stages of the transplant journey, the second stage was your in-hospital stay or your admission for your transplant. So any medications which are required during your hospital stay are covered, and there are no direct charges to the patient. The important thing to note, and it is really important to kind of have these plans in place or know your drug coverage before getting your transplant. So it's not something that's kind of a surprise during the perioperative or post-transplant period of time. Is what are your drug coverage options once you are discharged and receiving medication in the community? Because this is the time where patients are going to be responsible for the cost of these medications. So it is really, really best to investigate this before the actual transplant procedure. And there are, medication reimbursement specialists, social workers. This is all part of the pre-transplant workup to investigate drug coverage avenues and what's available to our patients to ensure that cost is not a barrier to a patient receiving their or is not a barrier to a patient being compliant or receiving their medications after transplant. So there's two different types of coverage. There's private coverage and public coverage. So private coverage is coverage that's provided through an insurance company, typically through an employer, or you may be covered under a family member or a spouse. One thing that I really like to impress on our patients is that what your coverage is may be different than another transplant patient's than versus another transplant patient's. Each person's coverage is unique. There may be a percentage that you are responsible to pay out of pocket. There may be a dollar value that you have to pay for each prescription. Or there are some times that these high cost drugs, which a lot of our transplant medications are, require special application processes to have these medications covered. So this is where we as a pharmacy team, along with our medication reimbursement specialists and sometimes social work, will get involved to ensure that patients are, you are using all the different insurances available to them and using them in a way that is the most advantageous. One thing to consider is that some plans will have an annual or lifetime maximum. And depending on your individual insurance, if you do have private coverage, it is not uncommon for our patients to reach these annual or lifetime maximums throughout their need for medication therapy. The other side of it is public coverage. So in Ontario, there's several different ways that patients get coverage through what is called Ontario drug benefits. The first of which is if a patient is covered through ODSP, which is Ontario Disability Supports Program. There are medications that are covered. There is a list of medications covered, and the second one is patients who are over the age of 65. So in Ontario, you are automatically enrolled as long as you have a valid health card and you're over the age of 65. The third is one called Trillium Drug Program. This one is different in the sense that it's an application process and coverage is based off of your personal or household income. So it's actually tax season now. So one of the important things is that patients who have Trillium drug coverage is to make sure that you are actively filing your taxes each year, because that is how the government, through the Trillium drug program, determines your what's called an annual deductible. And if they don't have that up-to-date information related to your taxes or your income statements for the year previous, it actually leads to disruption of coverage, and at which point, can lead to significant upfront costs for our patients. The next thing I'll talk about is sort of why we're here talking today. There's these things called brand assistance programs. And within the pharmacy world, it's not specific to immunosuppressant medications, but the great thing about it is that there are brand assistance programs in place for a lot of our brand name immunosuppressant drugs. So what these are cards that are accessible to pharmacies or to patients that help to cover cost differences between the brand names and generics. Now, the question may be, if my drug coverage only pays for the generic, is it okay that I take the generic drug? And at our site, or within the multi-organ transplant team here, it is recommended for certain drugs, including your tacrolimus products and either your Myfortic or Cellcept, that you receive the brand name product. And the reason being is, since, as I previously mentioned, these drugs are carefully monitored through blood work, if ever there's variations in your levels, by staying on the same brand, it eliminates one potential risk or one potential factor why those levels may be changing, and allows your doctor to more accurately adjust or make changes to your therapy to get you back within what we call the therapeutic range. Because in Ontario, or in Canada, sorry, my apologies, for a generic to come out, it only has to show that it is, in general terms, very, very similar to the brand name medication, but it does not have to show that it is the exact same. So we want to eliminate or mitigate any potential, I guess, variables and make it easier for us as practitioners, pharmacists, doctors to determine what is truly causing any changes in your levels. And by eliminating a change in brand, that's one way we're able to do so. But the thing is, we don't want our patients to have to pay and incur a greater cost to get these brand name medications. And that's where these brand assistance cards or NovaCares cards, which I'm not going to talk into great detail of because we have Mariana and Kathy here to talk about those in the next few slides as well as videos. So I don't want to take their thunder, but just do know that these are programs that pharmacies have in place and can access easily. So that's where us as the transplant outpatient pharmacy, we really are experts in navigating these programs to help our patients out with cost. So there are brand assistance cards for Prograf, Adforgraph, Myfortic, and CellCept to help cover cost differences. So I do also like to kind of share, what can a patient do, or what can you do if you're a patient here in this seminar to ensure optimal medication care is to first off take medications as prescribed by the transplant team. If there's one thing I can share with the people on this in this seminar is compliance is really important. Taking the medications as prescribed, taking them, as close to the same time each day as possible, and ensuring that you're not missing doses of your immunosuppressant medications is one of the best things that you can do to ensure that you are treating your newly transplanted organ, or even if it's been a period of time since your transplant, to just maintain it as best as possible, as that compliance is taking those medications. Also to complete that routine blood work, because that is how your doctors are assessing how those medications are working, or one of the tools that they use. And it's also important that you get your pharmacist involved if necessary, if you're review any new medication, vitamins, or supplements. The important thing is that pharmacists have the ability, the expertise, and the knowledge to assess whether those new vitamins, supplements, or medications have any drug interactions or negative effects or in terms of your immunosuppressant medications. And I really like to say, take an active role in your medication care, ask those questions, be an advocate for yourself in terms of exploring all the different avenues when it comes to the medications you're taking in terms of cost, compliance, as well as drug safety. So I really always like to ensure that our patients stay actively involved in their medication care. So you may ask, what is the role of the pharmacist, or where do we play a role in your transplant care? So we are really your experts in counseling and compliance. We have the ability to provide medications in different forms. Some patients like vials, because then there's active care in terms of remembering, hey, I have to take medication A, B, and C in the morning, D at lunch. And by taking those vials and taking them, it helps them stay on top of their medications. Or there is the opportunity for compliance packaging or blister packaging. Some patients may be on 15, 20 different drugs. And just this aid in terms of helping ensure that these medications are taken daily is something a pharmacy may be able to provide. Definitely a service that we provide at our pharmacy. Again, as I mentioned, is that we ensure that your medications are all safe to be taken together. We'll do drug interaction checks just to make sure that everything taken together is not going to have any negative effects on your transplant. As well as we have the ability to evaluate blood work when it's available and make recommendations while working with your transplant care team to ensure that you're getting the best optimal medication care possible. So this is essentially to ensure that your medications are all appropriate and at the right dose. So that is my little piece of my presentation within the larger group here today. So, again, thank you, Candace, for providing me this opportunity to speak to everyone. I will stop sharing my screen, and if there's any questions, I guess, Candace, you can kind of be the buffer for everybody, okay?
Sounds great. Thank you so much, Derek. That was some great information. As a transplant patient myself, a lot of the questions that I have had over the years, the pharmacist has been my go-to for all of those questions. I've actually had my pharmacist for the entire almost 15 years that I've had my transplant. So I have a very close connection with her and often send her quick messages over my app just to say, is this okay? Is that okay? So I'm sure there's a lot of questions here. So for those of you who are listening, if you have a question, you can either raise your hand with the little hand gestures underneath. You can also type your question in the chat, or you can unmute yourself and ask your questions. I also have some questions from people who emailed in some questions. So if there's anybody who wants to start, you can feel free. If not, I can go through some of these questions that were sent in as well. We have a couple questions in the chat as well. One of them is, what should I do if I had drug coverage at the time of my transplant, but now post-transplant, I no longer do due to changes in employment status?
Yeah, so that's a great question and unfortunate, not a unique circumstance. So there are, at which point, if there's no private coverage, my recommendation would be to explore the avenues of Trillium drug coverage. So as long as you're an Ontario resident with a valid health card and up-to-date tax information for the year previous, everybody qualifies for Trillium. So just to give everybody here what that coverage would look like, is you would be assessed an annual deductible. So let me ballpark a number here. Let's say a person or a household makes, I'm going to take an easy number for me to do quick mental math, $100,000. So that annual deductible is 4% of that household or personal income. So that's $4,000 a year. Doesn't mean that you're required to pay $4,000 up front. It's broken up into 4 different quarters of the year. So August, November, March, and May. At the beginning of each of those quarters, you would be responsible for paying your deductible, at which point, once that is satisfied, any medications, and I always like to go with this caveat, same with private insurance, any medications covered by the insurance program. So this oftentimes does not include over-the-counter supplements, vitamins, at which point, at that time, it would go down to $0 because you've matched or you've paid off your deductible for that quarter. Then that restarts the next quarter. So if you've paid it off in August, if you have to refill any medications in September and October, those are $0 out of pocket. But then starting in November, you're going to start paying off that next quarterly deductible again. And then that, along with these, with our brand assistance programs and those are things that we can investigate to see what strategies we can use to help support our patients pay as little out of pocket as possible.
That was the follow-up question was, if the deductible is too expensive for the patient, is there also a way to get support for that?
So that's in general practice, I would say unfortunately not. That is because they do look at household income. I do acknowledge 4%. It's not insignificant. There are a lot of other costs present within an individual's life. But that's why they do it based off of income.
Okay. I am just going to put in the chat here for everyone as well, if they need more information about the Trillium drug program, I'm going to put a link in the chat to the guide to understanding the Trillium drug program as well, so that you can take a look at that if you have more questions as well. This is one that I get asked a lot from people is, if I have a cold, seeing as transplant patients, we get a lot of those colds and flus. Is there anything over the counter that I can take that are safe with my post-transplant medication?
Yes, I think that's a great question to have. And I never like to give a blanket statement, but there is one blanket statement that we always like to share, is that always best to avoid, or it is important or imperative to avoid any what we call non-steroidal anti-inflammatory drugs. So those are things such as your Advil, ibuprofen, naproxen, if you're needing something for pain relief. The reason being is many of your transplant medications work through your kidney or have effects on your kidney, we don't want to add on an additional medication that also has negative effects on your kidney or require your kidney to get rid of that medication. Whenever we get these calls, and we get them, quite frequently, or we get patients coming up to the counter, it always requires a bit more investigation. Is it a cold? Are there other symptoms that are causing it? Simple things such as if you have a dry cough and you just want to take an over-the-counter medication, there are things that can be taken. Tylenol for pain or for fever relief is also safe to be used as well.
Great. That's wonderful. I know that one comes up a lot, especially in my household. I have a 3-year-old who is now in daycare. So let's just say it's happened more this year than I think ever in my life that I've had colds. So that's great. So we're going to move along. However, I know everybody has thoughts and questions for Derek. So we will have some time at the very end. If there's more time and you think of other questions that you have for him, we'll open that up. Also, if we run out of time, you're free to send an email to me and I can forward that to him as well. So thank you so much, Derek. We truly appreciate everything that you do and all of the support for tonight as well.
Thank you, Candace. I'm happy to be here with everyone.
Thank you. So now we are going to move on and welcome our teams. First, we want to say thank you so much to our Astellas team for sponsoring this event tonight and for all of the remarkable support to all of our patients, families, and donors across the country. They are a fantastic partner in everything we do, and they are always right behind us to support us. So thank you so much to Astellas for their support tonight. And also thank you to STI. And STI is going to join us tonight. We have 2 people who are joining us to help us through discussing these programs. So welcome first to Mirjana Ruzic. She's the Associate Director of Sales and Corporate Accounts. Mirjana is dedicated to enhancing patient health outcomes by creating and providing essential patient support programs to Canadians in need. In her role as Associate Director, Mirjana manages the continuous development and improvement of her programs. And we also have Kathy Camo joining us. She's the Senior Manager of Reimbursement. Kathy is STI's Senior Reimbursement Manager and has been with STI for 12 years. With a background in community pharmacy and a wealth of experience in the broader pharmacy world, Kathy is STI's go-to expert on all things reimbursement and education. So thank you both of us for joining us tonight and for all of your support.
Happy to be here. Thank you.
So tonight we are going to direct our questions about InnoviCares and Expedite to these 2 wonderful people. And we're going to start off in regards to this presentation with discussing InnoviCares. Now, InnoviCares is a free prescription savings card, and Derek talked a little bit about that. This card helps you save money on select prescriptions by paying a portion of the cost at the pharmacy. It works just like any drug insurance coverage and can be used with or without another drug program. It's incredibly easy. You visit innovicares.ca and download your free card. You present the card along with your prescription at your pharmacy, and the card will automatically cover a portion of the cost of your prescription. So most of us would have had a conversation before we received our transplant about some of these support programs, but sometimes we go through the process and we may not have been registered or we're not sure what we're going to need. So tonight we're going to talk about these 2 wonderful programs so that we can understand it a little bit more. And of course, the easiest way, at least for me, is to always watch a video rather than talking about it. So what we are going to listen to is a short video about the InnoviCares card, and it's going to instruct us on what it is, how we use it, and all of those wonderful things. So please let me know if you cannot hear it, and I can adjust the sound.
If you are a Canadian without health insurance benefits, your insurance doesn't cover the cost of your brand name medication, or only covers a portion of the cost, InnoviCares can help save you money. The InnoviCares prescription savings card helps Canadians with the cost of select brand name medication at pharmacies. This free card is available to all Canadians, insured and uninsured, who want to save money on select brand name medications. Even if you already have a drug plan, InnoviCares can help reduce the cost of your copay. Simply present the card at your pharmacy to start saving on the cost of your brand name medicine. No need to wait to be reimbursed. The benefit is applied directly at your pharmacy, and your card will never expire. Helping you save money on your prescriptions is our focus, and with the InnoviCares card, you have more freedom to choose the brand of medication that works for you. Join the 2 million Canadians who are already saving on a wide range of brand name prescription medications with InnoviCares. Visit innovicares.ca to learn more and download your free card today.
Amazing. It's very straightforward about what the card does and how to access this card. And for people who maybe don't know a lot about the card or have never used it, I can tell you from my personal experience, my pharmacy had an issue with their computer systems for about 3 weeks. And one of the medications that I use that is covered by this InnoviCares card, I went to get another refill. And when I went, it was close to $1,200 for the 3 months. And so, of course, I was shocked because I've never paid that much ever. And I said, what's going on? This should not be happening. And we later found out that there was an issue with their computer programs. And so my Innovi card was not kicking in. And so luckily I had enough to cover myself for a little while. And then when I went back to pick up my prescription, it was about $200. I mean, that is huge. This was close to Christmas as well. So you can imagine thinking about putting out $1,200 versus $200 for a patient. It's a huge difference and a massive support to all of us patients. So I'm wondering if anybody has any questions specific to this InnoviCares card, or any questions for Mirjana or for Kathy about this program. And you can either raise your hand or you can put the questions in the chat as well. And Mirjana, also, if you want to say a little bit about this program or yourself, similar with Kathy, feel free.
Well, the program is really well designed. It's super easy to use. You go under innovicare.ca. You do not have to have a coverage. You do not have to file your taxes either. So you can just download the card. The really interesting thing about this program is that it has a lot of different brands on it. So you will potentially benefit not only for one, for the multiple brands, and it really offsets that price. It's really widely used. It sits in your profile in a pharmacy as a private plan or a government plan, and it just hits that card first before there's anything remaining left to pay cash, if you don't have any previous coverage. So, so it's really super easy to use, and it works at every single pharmacy across Canada.
Amazing.
Yeah.
And the best part about it that I find is I don't have to have a card. I don't have to present it every single time.
No.
I did it once and I never have to do it again. So it's almost like I don't have to even think about InnoviCares. It's just there, and it's always there to help me at the pharmacy. And so it's fantastic that it's only a one-time thing that you have to go through to set it up.
Correct. Yes.
Amazing.
If you're ever wondering what drugs are covered, when you go to innovicares.ca, just look under your province and it'll list all the medications that are covered. So it may be more than just one, might be many. And be sure to let your pharmacist know you want the brand name as well.
Exactly. And usually on average, we have anywhere around 100 different brands listed. So it's really useful.
Amazing. And Kathy, in your many years of supporting patients, is there something that has been common, either with issues with Innovi or questions that people might have, or common things that you experience?
The biggest question that we get is, who's paying for it? Are you sure it's really free? That is the biggest question. I just have to download a card and then I get my brand name medication for almost the same price as the generic. What's going on? It's almost like it's too good to be true. And I've had stories where people were going to pay for the brand name anyway. And then once they find out that they don't have to pay so much money, it really changes their world.
Mm-hmm.
Yeah.
Yeah, especially with a chronic condition or a transplant, those kind of things. People are nervous to change their medication,
Mm-hmm.
even though they're interchangeable.
Absolutely.
Yeah.
We may have a question here in the chat. Oh, so the question is, depending on where you are, why isn't Inovi Cares talked about more in transplant clinics? That's a great question.
Well, it's interesting. We really don't know. We try, and that's the reason why we are having webinars like this. And of course, Candace, with you and collaborating with you and bringing just a little more awareness to what it's available to patients out there. We hope to do a little more. But thank you for your partnership. I just think that healthcare has been really hit hard, and there's just so many things to talk about. And I'm sure that your healthcare providers have spoken about it, maybe even your pharmacists, but sometimes there's just so much information coming all at the same time.
Yes.
So sometimes it's just a certain setting like this, that will really allow to really understand everything that it's out there that potentially you can benefit from.
Absolutely.
And Mariana and I
Wonderful.
have done different education sessions with the UHN teams to help them understand this program and the benefits to the patients.
Yeah.
That's been the past year.
Fantastic. And just to let everyone know as well, when we post this webinar online on our YouTube channel, we're also going to post these short clips as well. So if you ever want to go back and just watch the video about Inovi Cares to get the website or to learn a little bit more, or if you know someone else who could benefit from this, you can just send them this short video as well if you'd like. So we are going to now move on to
If you were a Canadian,
discuss another program that is supported by our STI group here. This is the Expedite Patient Assist Program. Now, undergoing a transplant surgery, we all know, is stressful. It's a major event, and we need all of the support that we can get throughout this journey. This Expedite Patient Assistant Program was designed to ensure that we have access to medications that we need throughout our transplant journey and throughout our treatment journey. So this Expedite program is different than Inovi Cares. These are two different programs. This one offers financial assistance to offset the cost of our post-transplant medication. So that's similar, but there are some differences. So this provides eligible patients with a 4-week bridging period as well, with 100% coverage of the medication you need at the time you need it most. So when you receive that transplant, the day that you get your transplant, 4 weeks post that, it may take time for certain programs to kick in, or your insurance to kick in, or for Trillium to kick in. This program provides that 4-week bridging period to ensure that you are not left without things that you need. The eligibility and benefit you may receive is based on 3 main criteria. And we have a short video after this as well to go through some scenarios too. The criteria are your transplant and the medication you've been prescribed, the drug plans you're enrolled in and eligible for, and your household income. And so if you want more information on your eligibility and how to enroll in the Expedite Patient Assistance Program, you can speak with your transplant team. And next, I'm going to show you a short video about this program.
Navigating life after a transplant comes with its own set of challenges. There's a lot to prepare, and it can be overwhelming. The Expedite Patient Assistance Program provides financial support to eligible patients to offset the cost of prescription medication post-transplant. Eligibility is based on 3 main criteria: transplant and the medication you've been prescribed, drug plan, and household income. Benefits are determined by assessing your drug plan and household income. Your transplant team can help to evaluate your individual financial support, as benefits may vary by province. Enrolling in the program is quick and easy. Here's how. When prescribed your new medication, you'll receive a brochure and card, or will be instructed to download an e-card. Head to Expedite Supports or call directly into the program to enroll the card and complete basic personal information forms to determine your eligibility. Within 2 hours, your card will be active and ready to use at pharmacy. You'll receive a welcome letter detailing any further steps or information required to complete enrollment, such as Trillium confirmation or notice of assessment. Taking medication after a transplant is important, and ensuring that you have supply is key. That's why you'll receive an initial 4-week bridging period with 100% coverage of the medication available on the program, allowing you the time to begin treatment, enroll in plans, and gather documentation. Our caseworker team will call you from a 1-800 number to request the necessary information. If you're unsure whether it's an Expedite caseworker, you can call the number located on the brochure. Should financial situations change, our dedicated team is available to help. The medications covered on the program are also available on InnovaCares. To maximize cost savings with the Expedite benefit, we encourage all patients to use the InnovaCares card, available for free to all living in Canada. So how does it all work together? Private plans may only cover an amount up to the cost of the generic drug, and InnovaCares covers the costs up to the difference between the generic and the brand name drug. Financial assistance is then provided by a public plan before the Expedite benefit is used to lower the patient's out-of-pocket costs for the medications covered on the program. Meet Mo, Sophia, and Nico. They recently underwent transplant surgery and enrolled in the Expedite program. Mo has a household income of $72,000 and has private coverage through his job, covering an amount outlined in his plan. The program will now cover 50% of Mo's out-of-pocket costs. Sophia has a household income of $36,000 and has public coverage. After public insurance covered their stated benefit, the Expedite program will cover up to 100% of Sophia's out-of-pocket costs. Nico has a household income of $81,000 and is enrolled in both a private and public plan. He coordinated the benefits with his private provider and receives financial assistance from the public plan. Nico is eligible to receive up to 50% of his out-of-pocket costs through the program. The Expedite Patient Assistance Program prioritizes well-being at every step and provides support to patients when they need it most. For more information or to determine your eligibility, consult with your transplant team.
Fantastic. I'm going to bring it back to our team here, Mariana and Kathy, about that program. And you know what? The comment that I have here is, can we go back to the video and pause on the percentage? So I can give that a shot. I'll see if I can scroll through here and see if I can find, there it is. I was very close. Right here, I think, is what people are interested in seeing. So that was the question, is can we take a look at this benefit calculation? I'm sure there may be some questions here. We've got another question in the chat as well. The question is, which transplants are eligible? Are lung transplant recipients are eligible for Expedite as well?
So I would say you really have to talk to your transplant team, because it does matter what medications you're given post-transplant as to whether or not you'd be eligible for the Expedite program.
Okay, so it's less about the organ, more about which medications are being taken and which medications are listed for coverage.
That's right.
Okay, fantastic.
I mean, the desire from this session here is for you to know about this program. And next time you are meeting with your transplant team, if you are not familiar with this program, please start that dialogue, because there's different components to this program. So it's going to be really important that you speak with your healthcare provider first. And but it's important for you to know that this program is available. And these are some of the main criteria around this program when it comes. So this program, like Trillium, it does require you to submit your taxes to have access to it. But in terms of the product and the transplant type, really important that you connect with them, because this is one program that it's been around for a while, and likely all your healthcare providers and the transplant team will be very familiar with. So that will be probably the best way to approach that.
Yeah.
Wonderful.
Yeah.
Well, I'll ask another question that I asked previously as well with you, Kathy, as well. Is there something that you hear commonly from patients when they either are looking to enroll in this program or they are enrolled? Are there common questions that you've answered? And same with you, Mariana.
Yeah.
So I would say one of the biggest pieces of feedback comes from patients when we're reaching out in that initial period to get their documentation. Understanding patients are going through so much information post or pre-transplant, then you've had your transplant and you're just trying to deal with every day, and then you have somebody calling and you have no recollection of having this conversation about somebody calling you. So there's some confusion there. So we're really pleased to be able to highlight the parts and the components of what we'll be looking for. And once we receive the validation of your income, what kind of insurance you have, and all of those things, it will work right away. So that is usually the biggest issue that we have. The rest of it is easy.
And the reason why that happens is because we call from 1-800 number.
Yep.
And I am one of those people that sometimes chooses not to answer.
Yes.
But I think it's really important that you are aware that you are going to be receiving that phone call. And it's totally okay to say, nope, I'm not going to pick up. But on that brochure, you're going to see that 1-800 number. Keep in mind, you have 4-week period for us to be able to collect additional information, because you want to ensure that you actually stay in the program and obtain the benefits from the program. Because it is a lot of very personal information being asked, like notice of assessment. So, yeah.
Okay, wonderful. All right, and those are the only questions I have from the chat. So I want to take some time to thank our partner Astellas for sponsoring this amazing webinar and for always being such an incredible partner with us through all of this in helping us to get information to patients and families and donors. We couldn't do a lot of the work that we do without them. So a great big thank you to the Astellas team and especially to Oleg for all of your support in everything we do. And then next, what I'm going to do here is I'm going to leave this last slide up for everyone so that we have this here for the Expedite program, which we just talked about, and then the Innovi Cares program as well, which we spoke about first. These are the two websites that you can take a look at. You can download an e-card. You can get information about which medications are covered, and you can talk to your transplant team about this if you're not sure if you are registered, or you're not sure if you are able to be part of this Expedite program. So with that, what I'm going to do again is I'm going to open it up. We have about a few minutes left for some questions. If you have any questions either for Mariana or Kathy or Derek, feel free to either unmute yourself or you can type them in the chat. And I also got one that I think is quite common with transplant patients. This one, again, is for you, Derek. The question was, these prescriptions are wonderful in keeping us alive. However, they are not so great for my sleep. Are there any recommendations on either timing of when I can take my medications so I can sleep better at night, or sleep aids that are safe for transplant?
Yeah, so thank you for that question. Unfortunately, it's always one of those side effects we commonly see in our patients. Hopefully, it gets better as you progress down your transplant journey. In terms of things that I like to talk about, and maybe I'm a bad pharmacist in this regards, is what I call sleep hygiene or non-pharmacological techniques first. So myself, I'm guilty of being on my phone right before I go to sleep, put my phone down at the side table and try to fall asleep right away. So you know that the light from your screen, watching TV, those sort of things is the first thing that I always recommend to eliminate. And then also building a routine into your sleep. So you know, put your phone down, go brush your teeth, maybe read a book for a few minutes, and then try to sleep. But that doesn't always work for everyone, and there are requirements for additional aids. So there are safe medications to be taken. So for over-the-counter, our transplant patients, it is safe to take things such as melatonin. One that I will strongly talk about in terms of an over-the-counter supplement that some patients use is called magnesium. So people may use it to help them stay calm. Some people use it for sleep. There's benefits in terms of patients experiencing or the general population experiencing better sleep with magnesium. But the important thing is it interacts with some of your immunosuppressant medications. So if you ever make the decision that you would like to start taking magnesium for sleep, please, please, please talk to your pharmacist first before making that decision, because there is a very important interaction with, in particular, your Myfortic or CellCept if you are a patient on those medications and taking magnesium. Other than that, it would require maybe talking to your doctor, looking at other safe medications for sleep aids. But there are options out there.
Okay. I know for sure I made a joke with a lot of my friends who are newly transplanted because when I went home, I was on about 30 milligrams of prednisone.
Mm-hmm.
Now I'm only on 5.
Mm-hmm.
And I think about 3 weeks into being home, my husband came down the stairs at about 3 o'clock in the morning saying, "What is that strange sound?" And I couldn't sleep. So I was scrubbing the grout in our kitchen on our floors because I hadn't done that. And I said, I feel like a bug trapped between the screen and a window right now because of my medication. And there's too much going on in my head and I've got a lot of energy. So I was trying to get it out that way. The thing that helped me was I didn't know the timing or I didn't listen properly when I was chatting with my pharmacist. So what they recommended was actually to take my prednisone right when I woke up in the morning versus taking it later in the day as well. And that was a huge help as well to change the timing of my prednisone.
Sure. Yeah, prednisone is a very big culprit for that sleep issue.
Mm-hmm. And this question is either for Mariana or Kathy. Is it possible to enroll patients in the Expedite program during the post-transplant hospitalization? So while people are still in hospital, because there are certain patients who have difficulty in filling out documents and providing information.
That would be why it's really important to talk to your healthcare team, because they can help you do that as well. I think Derek mentioned earlier that there's social workers and there's a whole team of transplant folks who can really help you do that. And that's when you should be applying, is after you've had your transplant, before you get to the pharmacy. That way you have coverage when you need it.
Correct. And that's the reason why we have that 4 weeks of bridging as well, because those times are difficult and patient might still be in a hospital transitioning. So, so that's why the purpose of that 4 weeks is there.
Fantastic. Thank you. And then there's another question. This is more of an innovation question for you, Derek. Has there been any research in advancing either alternative medication for anti-rejection or things like less medication or not being able to have to use anti-rejection medication at all?
So that's a great question. Innovation is definitely something that's always happening in pharmacy. I will say in transplants in the last 20 years, not a lot of changes in terms of the medications that are used. but there, recently there has been investigations or new prolonged release tacrolimus product that is available now, that is being used in certain transplant populations to see whether or not this profile of having it being extended on an even longer period of time helps to reduce the long-term side effects of tacrolimus. And then the last question was, is there an opportunity or where there is a need for no immunosuppressants? I will say at the current time, with that current balance, no. I will say in generalities, there is likely always going to be a need for some level of immunosuppressant medications, whether that be 2, 3 agents. Certain organ groups may only use one. In particular, our liver patients do tend to be on much less immunosuppressants over a period of time.
Wonderful. Thank you. Yes, that's definitely always in the back of our mind. And of course, a big hope for the future that we won't need to take those medications. But while we do use those medications, it is wonderful to know that we have great medication, great pharmacists, and great people who are providing these programs for us to take good care of us. We don't have any more questions in the chat or from what was sent in. So at this time, what I'd like to do is just thank everyone who has attended tonight and thank our incredible speakers, Mariana and Kathy and Derek, and also thank again, Estelis, for all of your support. If you have any questions about either the two programs or you have questions that weren't answered by Derek tonight that you think about, you're going to receive an email from me with the link to this webinar, as well as some more information. And you can always reply to that email and ask your questions at that time as well. So again, thank you so much. We are incredibly grateful that you joined us tonight, and hope you have a wonderful evening and best of luck with your transplant. Thank you so much.
Thank you so much for organizing this. Thank you.
Thank you.